In southwest Georgia, in the small city of Albany, an unlikely coronavirus hotspot. As of March 30th, almost 600 cases, 24 deaths, more than Atlanta and Fulton County, which are 12 times as large.
Throughout the community, there's a unhealthy but understandable cauldron of emotions. I mean, it's grief, fear, confusion, anger, and of course, anxiety about what the future is going to bring. Why did it strike Albany, Georgia?
Albany is a city of 75,000, but it has the feel of a small town, a town now seemingly abandoned. Coronavirus likely arrived here with several large funerals at the end of February and start of March, gatherings that drew people from all over. Early on, local officials said,
"I don't think folks are taking this threat as seriously as we should. The coroner has got on his podium and he has explained people are dying."
We've also had many reports that a lot of folks have been carrying on large cookouts in their neighborhoods. That is counterproductive. We need people to stay within their family units so that this disease does not continue to spread.
Now, a strict shelter-in-place order has cleared the streets. It all may be a sign of what smaller cities and hospitals could face as coronavirus takes hold across the country and testing improves.
We were in the middle of it before we realized that Albany was really a flashpoint.
At the center of the crisis is Phoebe Putney Memorial, the only hospital in Albany. Inside, everyone now wears a mask when around others. Scott Steiner is the hospital's president and CEO. Once alone, he took off his mask for this interview.
It's all crossed our mind, why, right? Why here? Why us? But in the end, we prepare for things like this.
The hospital thought it was prepared with 6 months worth of protective equipment like masks. It ran out after a week. So it had to get creative, sewing its own kind of mask.
The idea is you would cover that N95 mask as that caregiver would go into the room. It would protect any particulates that got onto that material. They'd exit the room, they'd be able to take that off. We can wash these, so they're reusable. We wash these every evening, and then they can keep wearing this N95 as long as it was contaminant free. So we began to extend the life of these.
But now elastic is all but gone, so more creativity.
They've used ponytail holders that they've cut in half and sewn those in. But it's every day is different. And so getting our hands on materials, whether it be this, whether it be face masks that we began manufacturing our own face mask out of this film and some elastic and foam.
Phoebe Putney's 3 intensive care units, 38 beds, are now full with COVID-19 patients only. A 4th ICU is handling everyone else needing care.
But last night we stood up our 5th ICU and to take COVID patients. So we've got 6 of those patients in there now. We think we can go to 11.
Caring for coronavirus patients takes more nurses, and it takes longer because those nurses have to suit up.
If somebody had 100 critical care nurses that they don't know what to do with, you bring them to Albany, I'll put them to work. But again, that doesn't exist.
Now the National Guard is here to help with the medical response. Albany has seen hardship before. In 2018, Hurricane Michael left its mark. Power went out and stayed out. But coronavirus is a different challenge.
Many of my friends, co-workers, some family members, let's keep them in prayer because it's people that you know that are falling dead.
The mayor of Albany wants other cities and other places to get ready.
Implement shelter-in-place ordinances before this happens to your community, and at the same time, prepare for the worst.
At Phoebe Putney, there's a fight against the worst a virus can bring. But it's also a place that may have the best cure.
Somebody asked me tell me about the fear, and I don't see fear in people. Do I see some weary eyes? Of course I do. But there's no fear here, and people don't feel overwhelmed. To the contrary, I think people know that, look, we didn't bring this here to Southwest Georgia, but we're going to be part of getting it out.